Um, as everybody knows, the Global Health Strategy was launched by the EU at the end of 2022. And what we realized that maybe several stakeholders across Europe, they have not properly received or incorporated the strategy at the national level. So that's why we are trying to, and this could be a problem in speaking with one single voices. So these difficulties arise from the absence of a sort of evaluation of the degrees of which the EU Global Health Strategy has been perceived, has been known, and how the country align with the strategy. And it's also possible that most of the relevant stakeholders at national level may be not fully aware of this strategy, of the strategy. That's why we started with the aim to evaluate the current level of awareness and impact of the strategy among key stakeholders in EU member states. We launched this survey on awareness, knowledge, alignment of European stakeholders with the strategy. It was launched a questionnaire at the end of 2024, and through partners at the country level, we disseminated to stakeholders the questionnaire. The partner at the country level in member states in the country that are participating with our joint action identified through a sort of stakeholders analysis partners in their respective countries, and we insert these stakeholders in a matrix that is divided by subject, key players, crowds, and players with different level of interest, high and low, and power, high and low. This is an example for Italy, but we did for all the countries. I mean, you did the respective part in each country. They did for the countries. The question was structured in 12 questions divided in 4 sections. The first one is mainly general information, which is not what was not mandatory, but was made with the aim of asking the people the consent to put their name and contacts in a sort of database of stakeholders in global health in Europe. The second section, 7 questions, was on the knowledge of the strategy. The third section was on the promotion and implementation of the strategy at the country level. And the last section was a sort of analysis of which are the global health players, policy makings, financing mechanism in respective countries. Preliminary results of the survey. We had 185 respondents representing 160 institutions from 20 countries, from Austria to Belgium, Bulgaria, and so on up to Ukraine. We had no answer from Greece, Portugal, Romania, and Lithuania, and 33 respondents were excluded because were not relevant for the study. We are now conducting online interview with partners at the country level to understand, as we did for Italy, if all respondents are relevant for the purpose of the survey, because some may be not really relevant, and it will completely make a false answer in case we will include in the survey. Then we will actually we did 9 out of 20 scheduled interview, and we are by the end of July probably will finalize the others. The individual country profile will be compiled for each country and will include the responding institution that will be a sort of database of network of communication champions, and will be divided in 3 sections: assessment of knowledge, suggestion on how to improve dissemination, implementation of the strategy, and lastly, an overview of the mechanism at the country level. We will do also a comparative analysis of the main indicators and findings of the survey. This is a picture that shows the countries, the number of answers per country. So you see, for instance, there are countries like France, 47 answers, other with only one answer, like Spain, Belgium, and so on. So it's not very, very easy to compare country where you have a lot of answers with country where there are few answers, but this is what we have, actually. Some of the preliminary results of the survey. One of the questions, probably the base of this survey, was if the institution, the responding institution, was aware of the existence of the EU Global Health Strategy and about the content. We had 53 institution respondents said yes, very well. 77 yes to some extent. Probably they only know or went through some official statement, and 14 plus 5, 19, they said no or I don't know. Institutions aware of the existence of the EU Global Health Strategy are in green, light green for some extent, dark green, those who said very well. So you see the majority seems, is a self-report assessment, seems to have a sort of good knowledge or a certain extent knowledge of the global strategy, but there are some answer who say that no or I don't know. Second question was how the institution became aware about it. Most respondent, and this was is still under analysis, says that yes, through EU institutional communication channels. Another question, very, very important, was if the country has a national global health strategy. The 4 possible answers were yes, yes, but embedded in another strategy, no, and I don't know. You see, there are some contradictions because there are some countries like Italy, somebody says yes, somebody said yes, but embedded, somebody say no. So it's not very, very easy to understand, but for sure the 4 countries, France, Netherlands, Germany, and Sweden, listed in green, which presented yesterday the national strategy, they are coherent, apart from somebody from France that said, no, my country does not have a strategy. Most of the countries where there is a strategy, people, they seem to know the reality of the country. When we ask if they think it's useful or important to have a national strategy for global health, of course, many said yes, and but we had the 85 lines empty, and we have to understand why these are empty, but we can say that most are in agreement. When we ask if the country has a global health ambassador, explain that is an individual that is using his influence to raise awareness on global health issues and so on, 63 said yes, 45 no, 41 say that they don't know. Again, there is some, for sure, some mistakes, because Italy, I'm sure that there is no a global health ambassador, but somebody said yes. So probably there is still not unclear in some country what is officially a global health ambassador. Number 7, do you agree with the need to further disseminate information to stakeholders on about the EU global health strategy and the contents of the strategy? Yes, mostly they said yes. Now we are analyzing the qualitative answer to whom in particular should this communication be addressed, which communication channel should be used, and how can be strengthened the implementation of the EU global health strategy. Number 11, we ask to identify for each country 5 key institutions, agencies, or actors engaged in global health, and if there is a formal or informal coordination mechanism among these actors. There are several contradictions. It's just a very, very preliminary analysis what we did, but you see there are countries where they say yes formal, and at the same time they say yes informal, at the same time they say no. So it seems like according to the respondent, to the knowledge of the respondents, the answer can be different. Consideration from the survey, very, very preliminary consideration. For sure, this is the first ever assessment of knowledge, awareness of the EU global strategy and of the level of uptake, alignment, and implementation by member states. Is a first attempt to establish a sort of list of relevant stakeholders in the European Union. There are limitations, of course. Not all member states provided a representative sample of stakeholders' opinions. There are some with only one answer, so we cannot say is 100% true what is there. But evidence accumulated is crucial to allow design of properly targeted intervention and to enhance implementation of the strategy, intensify focus efforts in global health, especially now that global health, international health aid and cooperation is somehow stuck. Another consideration is that the survey revealed that there is a reasonable self-declared level of knowledge of the strategy, because many of the respondents say that they know very well the strategy. There are, however, contradictions within the same country, because probably some definition, what is a national strategy for global health, what is and which is the role of a global health ambassador, which are properly coordination mechanism, is not really clear or easy to be understood. There is the demand, finally, and the need for greater dissemination of global health notion about the European global health strategy. The results will be presented in a country profile that we are developing now with the collaboration of partners at the country level, and we are validating country by country the response that we gathered together from the survey with the knowledge or with the suggestion from the country contact person. Finally, we have, of course, the main need is to integrate the results of our work package into EU member state national policies. The result of the survey that will be summarized in this country profile then will be also probably included in a specific report or a scientific article uploaded in the so-called global health sphere web application that we will design at the end of the second year of project. Then the information will be used to generate evidence-based suggestions on how to improve dissemination and implementation of the strategy in the future. And for sure, the survey that we made confirmed the importance of coordinating efforts in global health at the EU level, because there is some discrepancy, and it's very important now to speak with a single voice, especially now that we have, as I said, several problems from the pandemic that we had some years ago to the decline of international health cooperation and aid. And everybody knows about what's happening now after the declaration of the President of the US. I would like to thank all the colleagues in the package 7, my colleagues here in Italy, and especially the colleagues of the joint action who contributed to the dissemination of the questionnaire and are cooperating now for the validation of the country profile. Thank you very much.